You know, women are often embarrassed to talk about this next topic, urinary incontinence. A lot of times it happens, when you cough or laugh suddenly, you find yourself, wetting your pants a little bit. Well, joining me now is Dr. Streicher. She's an OBGYN and professor at Northwestern University Medical School. Welcome. Good to see you again.
Good to be back.
All right, so we're talking about urinary incontinence, where you kind of leak a little bit. How common is this among women?
We're looking at about 30% of women leak urine inadvertently at some point in their life. And a lot of people think of this as being a little old lady problem, and nothing could be further than the truth. Because stress incontinence, the incontinence you mentioned, the cough, laugh, sneeze incontinence, is very often a result of childbirth. So we have women in their 20s, their 30s, their 40s who are afraid to laugh without crossing their legs. They're afraid to exercise. They're even afraid to have sex sometimes because they may lose urine. And then there's urge incontinence, which is the kind of, I call it the key and door continence. So you get to the door, you put your key in, you're fine, and then you realize you are not going to make it. And that is associated with older women. And then there are the women that have mixed incontinence, both stress and urge incontinence.
But there are ways to treat it, right?
There are a number of ways to treat it.
There's medication and there's surgery, but you have something new that doesn't involve medication or surgery and is very effective. Let's talk about that.
It's really interesting because at the end of the day, what causes the involuntary loss of urine is a weak pelvic floor. We have muscles that line, I like to think of it as the pelvic bowl more than the pelvic floor, because we have muscles that support the bladder, they support the vagina, they line the whole pelvis. And if those muscles are weak as a result of childbirth or surgery or a number of other reasons, that's what causes the problem. So if you broke your arm or you broke your hip, you would go through a lot of rehab and physical therapy to get those muscles strong and work in a coordinated fashion. And we need to do the same thing to help women with incontinence. So every single woman has been told to Kegel. And
Kegels, everyone hears about that.
Kegel.
How do I do them? But they do them wrong,
They do them wrong, and that's what the studies show, that the majority of women either do them incorrectly or they're ineffective because their pelvic floor is too weak. So the whole premise of this new device is to get women to Kegel correctly to strengthen their pelvic floor.
Right, so you have a device over here that's available over the counter that can help to strengthen the pelvic floor.
Exactly.
Right there.
This is what we call, this is a trip to the gym for your pelvic floor, but you get to do it at home. And basically it's a device that goes inside the vagina. There's a little electrostimulation that causes the pelvic floor muscles to contract. This sounds painful. It is not. It is completely comfortable. And a woman can do this at home to strengthen her pelvic floor, which has a number of benefits, as women are told with their Kegels.
Right.
But for women who have an issue with stress incontinence or urgency incontinence, we want to take it one step further.
And that's what this device is here. This is a much more advanced device, does much more for a woman. So break it down. How does this work?
This device is called Intone, and the way this device works is this is a very soft silicone-based device. This part goes in the woman's vagina, and the key is that every woman is shaped a little different. This is going to fit everyone because she herself pumps it up.
Right.
And actually it goes like this. She pumps it up to make sure that it's comfortable for her, and then the doctor in the office sets the appropriate stimulation level so that she's getting comfortable but stimulation that is going to strengthen her pelvic floor. And then this part is very important because this is her home coach. This is basically a device that will talk to her, tell her exactly what to do, and even more important, give biofeedback so the woman can tell if she's doing it correctly. And in addition to strengthening the pelvic floor, the stimulation also relaxes the bladder muscle. So that urgency incontinence I was talking about, that key in the door incontinence, it treats that as well. So if a woman uses this for 12 minutes a day, 6 days a week, over the period of about 4 to 6 weeks, she goes back to see her doctor periodically, who will then increase the intensity, make sure she's doing it correctly, and I actually hook this up to my computer so I can see how she's been doing. And what we are finding is that the overwhelming majority of women, that their incontinence is either eliminated, and if it's not eliminated, it's going to be drastically reduced.
And you're talking about women who have failed medications. You're talking about women who have failed surgeries even, and this is basically taking them to where they need to be.
But at the end of the day, we are finding that this works, and this is so important for women who are really embarrassed, humiliated, and it's impacting on their quality of life.
And 30% of women is way too big a number.
Way
Dr.
too
Streicher,
big.
thanks so much for coming in.
Thank
I
you.
really appreciate it.